timesheet. Rather unfortunate. Yeah, 719. Let's keep it with the doctors here and get Dr. Hoa Nguyen of the Governor's Physicians Advisory Council and American Medical Center Family Clinics. Good morning, doctor.
Good morning, Chris. Good morning, Beamer.
Good morning.
We just want to, I guess, just right off, get your take on this, the frontliners not getting the pay.
Yeah, that is a mess. I listened to Dr. Magnolia, and I think it's a planning issue from the beginning. I think that it's a full planning that part. But again, they have to go back and really they need to justify who's deserved and who's not deserved, because I think a lot of people kind of abusing the system. But the front line, like the nursing staff and the physician at public health, the tracing team, everybody worked really hard, and especially GMH nursing staff and the whole physician over there. Those guys, GFD, GPD, those guys gotta go first. Everyone else, directorship, gotta take the back seat somehow. It's the people that work. The work need to be the first one to get paid.
Mm-hmm.
That's how I look at it. You can scrape everything else, and you gotta go back and look at all the people that work and truly work. So.
It's kind of like, you're right, it's a no-brainer who should automatically get paid up front first.
God, I just got to say.
Frontliners check, okay, that's good.
We have a nurse governor. I don't know why this is even an issue. She should have been, hey, I'm looking out for my nurses. We're going to get you guys paid all up front, boom.
Yeah.
Instead, here's some roses. Love ya.
Yeah, she's going to be as good as the people that work for her, so.
Oh, you threw a little bit of shade there, Doc. Oh, man.
Well, I
didn't even go that far
to run my clinic, and my practice is as good as people that work for me. So it's not me; it's the people under that really do the hard work. And
right, win or lose, right, Doc?
Yeah, so that's the thing, that people know that under her, the one that should make her look good, and they should step up and make her look good.
I'm just saying, if we can fast track an electronic funds transfer to hotels, no questions asked and no paperwork, no nothing, then I don't see why we can't pay these nurses what they're owed.
That's a $1 million question.
More than $1 million.
Yes, and it's going to come to more important as we brace for the second wave or not. That's our own pray is not going to happen, but that's going to be much more important as it's this next 3 to 4 weeks will be in play when we are open to Pico 2 as of Sunday.
Doc, we spoke with Dr. Maglonia. Only 4 tests, conducted by public health. And she said, hey, that's all we got. But then she mentioned that the private clinics maybe have sampled more. How are you guys doing on testing? Are people still coming out to be tested at the clinics?
People are still coming out, Chris. But the good part about it is that we see less people that come in for any symptom in the past, 2 weeks or so. It kind of on and off. So, you don't run tests on everybody. You run tests when people come in when they get sick. So it's, if people are well, then there's less tests out there. There's nothing wrong with that. So that's kind of giving an indication that people are sick or not. But again, the next 3 to 4 weeks when things are open up and people go to the mall, people go to the beach, people hang around, that's when you see if the second wave will happen or not. We like I say, we won't keep our finger crossed that it does not. People are doing well. They wear their masks in public. They wash their hands. So those are the main things that keep the second wave from coming.
Right, Doc, I just got to interrupt real quick. There's a speed trap. Wendy's Barragata also got a report that officers are roving that strip there, so just heads up to all of our drivers out there.
Okay, so that's the part where, let's say, the next 3 to 4 weeks is very important to see. So we need to monitor very well. Public health need to have their test kits ready, and the team, the tracing and tracking team need to be ready to go if the second wave is going to hit. So everything has to be in place. Even the tiers 2, we are not put the guard down, and they still triage everything and just sit for the next 3 to 4 weeks and see it happen or not. So.
Doc, you guys had a Physicians Advisory Council meeting was that Sunday?
No, we have it on last Thursday, so we have again tonight.
Okay, so what are you anticipating the discussion is going to be tonight?
We are again talk about the guidelines for going from 1 to 2. Make sure that it's intact. Make sure that the public health are ready. Make sure everyone's ready in case something happens. So all those things have to be in place for us to be comfortable to continue on Tier 2 on the peak or 2. I think when the testing and the tracking is very, very important. Hospital, I think we are set. And the amount of case, everything is set, but the testing and the tracking is have to be in place. So that's the biggest thing we're going to talk tonight. Make sure things are in place for you.
Right. Dr. Manglotnia was mentioning that we received some serology tests, and I guess the idea of the UOG study was kind of scrapped. But you have these serology tests that are FDA approved or EAU authorized. What is the plan for those?
Yeah, they only have. I understand they supposed to have 1,000. Only like 250 or 400 kits here on island this time. I know public health have some, and those are serology for the IgG, IgM, and they are approved to be used. But I think it's a screening test, and then probably the people that the case people that have recurrent symptoms of 7, it's nice to go back and test them to see if they have IgM, IgG along with them. So I'm pretty sure we're gonna talk to her tonight and see if we can pull those people back and test them.
I'm sorry, who? The ones that have recovered?
Yeah, the one that the 7 recurrent one. There's 7 people that test positive and then released from public health clearance, and then they come back with recurrent symptoms.
Okay.
Yeah, those are 7. It's nice to see if they have the IgG, IgM, so we kind of know if they're immune or not. That's the one the 7 that we scratch our head.
Mm-hmm. There's something that I know you've been in the National Guard, right? Or military, retired military.
Yes.
Okay. I
Thank
wanted
you
to
for your
ask
service,
you.
Doc.
Yeah. I wanted to ask you about what's happening at the Pacific Star, and how we have directors and deputy directors, Adeloop staffers, and some other non-essential employees, and some essential employees that are up there staffing that hotel. Is this something that the National Guard could do?
We can. I'm not sure what happened there, but those position and the people that stay 24 hours, don't need to be the director. They can be anybody. That's the lowest paid person that should be up there to monitor. You don't have to have a highest paid person to stay in there 24 hours a day.
Right.
But is this something that the National Guard could do? Because I've seen all the videos of TR, and you had all the military from Anderson to the Navy all come together to serve the food, to disinfect the room, to clean the hotel. I mean, is this something that the Guard is capable of doing?
I think that's position anyone can do, including the Guard. I mean, they are ready. It's just that's the person available for the quarantine patients to get a hold of and to see what they need. So it's an admin personnel. It's a labor job.
It kind of seems also, Doc, like you would have if the Guard was to run these quarantine ISO facilities. They have the medical component, they have the security component. It seems like they have all the components that you would need to run a quarantine, and then the training as well.
Yeah, I think that's the key. But like I say, they need to go back and look and to clarify all that stuff. But it's like I say, it's done, and they just need to go back and fix the mistake. And like I say, if it happened again, that we have to second wave, then those things shouldn't happen again. But the quarantine hotel should be gradually go away. We work on the guideline for Koreans or passenger to come in, and we gonna try to get people in quarantine from home. So that is another one that the advisory board will review tonight. So we come up with guidelines for arriving passengers for CMI and also for the U.S. So those we're gonna try to recommend that they be quarantined at home rather in hotels. So that's gonna save money for the taxpayer.
Wow, somebody wants to save money for the taxpayers. So breaking news. I'm going to put you on, Bree. Let's run with this.
I did want to also just follow up as if whether or not there was any truth that we had National Guardsmen over at the non-COVID hospital.
That one I don't know. Sabrina, the National Guard is when we get activated, we can do a variety of things.
Right.
It's not limited to certain things because and they belong to the governor, and they can be tasked to do anything that involves security at any place. Even at a certain point when we have some problem at the clinic because people won't get inpatient. Yes, the National Guard can be asked to do that too. They are responsible for security and everything that the people of Guam need for them to be done. So I don't think they will restrict to anywhere.
Oh, no, but I'm wondering, as part of the Governor's Physicians Advisory Group, if you aware if any of the National Guard have been positioned or stationed or working at the Guam Regional Medical City.
I don't think so. I don't think so. They have their own stuff there. So I don't think that I ever see any guard member there.
Okay.
So it's I don't think so.
So Doc, just going back, are you saying that the Physicians Advisory Group is going to recommend to the governor that we close down the Guam quarantine facilities? Or are you recommending that we scale it back? Or just again on the record, can you just clarify what you guys are going to discuss and recommend?
As we go into PCOR 2 to PCOR 3, we're gonna look forward to open for tourists. And the biggest part about opening up is to make sure that it's safe for the passenger to come into Guam to the airport. To do testing at the airport for everyone coming in, it's not going to happen. You have millions of people come in, and even in the U.S., they don't do that. So, we have a different board. We call it the arriving passenger board. We don't have to report to the governor. It consists of a group of physicians and the GVB and Chamber of Commerce, and everybody's in there. And to try to come up with idea now to plan forward for the tourists to come in. So the first two that we're going to open to is the CMI, because you have to reciprocate. A lot of people go back and forth to Saipan for business, and then the people in the U.S., especially return residents. So we have to kind of start to come up with guidelines to post it up there so people to know what to do, what's the requirements for them to come in, what's the quarantine issue is all about. And, so we are drafting up plans for people to be quarantined from home. There's certain days that they have to be tested. When they arrive, they don't have to test before they come. So all that stuff has been working on. There's a draft already for CMI and USA that will be reviewed by the two boards, and then once they agree, then they have to come up to the governor to be approved. And one of the plan is for returning Guam residents, we're going to quarantine at home for a few days before they can have a test done, if the tests are not done prior to their arrival to Guam. So the only one that stay in a hotel if you are not from Guam and you come here for business or something, that you have to stay until you get tested to be clear. So if we the people, the passenger that will stay in the hotel, hopefully be a much, much lesser number, maybe just a handful or not by hundreds.
What about the ones that are currently there in quarantine? Is there going to be any discussions of just having them all tested and let them go on home quarantine?
Yeah, that's one of the if we pass this two board and get the approval, then yes, more likely there's a certain amount of days that we all agree that they can stay in there and they can be tested to clear them to leave to go home. But again, they still, even if they get clear to go home within that 14 days, if they have any symptom, it's mandatory for them to report to a clinic to get checked again. So there's steps there that we put in place in order to make sure that it's safe for them to be released to out in the public and back to their life in Guam again.
Okay, Doc. What time's this meeting and where are you guys meeting at?
The advisory board is every Tuesday and Thursday, and the arriving passenger board is every Friday.
Are these Zoom meetings, Doc, or?
It's on Zoom, yeah. Right now everything is changed in business. Is that we do Zoom, and it's very effective.
Yeah.
So it's a new norm for business nowadays. It's a Zoom meeting. So we do Zoom. Yeah, it minimizes the contact. It's kind of hard to have 15, 16 people sit around the table.
Yeah.
So.
The public allowed to these Zoom meetings?
No, I think right now it's just really, we discuss a whole lot of stuff, Sabrina and Chris, and it gives the freedom for people to talk. It's kind of, and if we release the information once it's clear, but when you have a public, it's very hard because people is not free to talk, and I really want people to, because we all work for one thing, right? We want the tourists to get back. We want our life back to normal again. So, people have some disagreements and different opinions, but I think they need to speak freely in order for us to come up with a good plan for Guam.
Right.
Well, thank you so much, Doc.
Yeah, Doc.
I guess we'll check in with you tomorrow and see what's the latest with this plans for home quarantine of arriving passengers from the CNMI in the U.S.
Right.
Yeah, it's something that we should do. So we're going to push forward at full speed on this one, hopefully by next week.
Well, thank you, Doc. Wash your hands.
Okay.
Thank you.
Okay.
Thank you, guys.
All right.
Take care.
Okay,
Hey, 7:36 again. It's the KUAM News Takeover, Guam's favorite containing COVID. We have to take a break. We're coming back, trying to get Father Paul on the line to talk about how the weekend went and the way forward as the church has reopened in their COVID-19 way. 7:36. Also, former Governor Eddie Calvo going to call in after the 8 o'clock hour. Again, so many ways to catch a